Mass Call 2 is the opioid overdose prevention grant that funded, I think it was like 12 or 13 communities in Massachusetts to do strictly overdose prevention work and educate high-risk populations about ways to prevent fatal and non-fatal opioid overdoses.
Back in 2009, no one had any idea that there was a problem in Quincy. They had no idea. And we touched many different sectors of the community. Of course, the police knew, but if you spoke to business owners or you spoke to the schools, they didn't recognize a problem.
I think by the end of the grant, when it was starting to wind down and we were moving into this next phase, people were actually really starting to acknowledge the problem and really come forward as advocates. People that had kind of been ashamed to talk about the issue, really, they wouldn't want to acknowledge that their son or daughter or brother or sister had a problem. And by the end of the grant, we really started to see people coming together in the community.
Can you tell me a little bit about the new program that you're working on?
Sure. So again, it's the Massachusetts Opioid Abuse Prevention Collaborative. We can call it MOPSI for short, which is what we do because it's just easier. And we're working with the cities and towns of Quincy, Stoughton, Randolph, Braintree, and Weymouth. And it's to kind of expand the impact of the overdose prevention work and to also really begin a lot of primary prevention work around opioid abuse.
There was a huge gap, which was totally recognized by everyone, that you need a continuum of care because there's a difference between sobriety and recovery.
Kids start using earlier and earlier, whether they're drinking at 13 or experimenting with marijuana, and just kind of, if that's the case, and then they later transition to prescription medication and then ultimately heroin, it's good to know that, the Department of Public Health is paying attention to this primary prevention issue and that there's something that we can do about it.